Basal cell carcinoma is a type of skin cancer that causes a lump, bump or lesion to form on the outside layer of your skin, epidermis. These lumps form on areas of your skin that get a lot of sun exposure. Treatment to remove cancer from your skin leads to a positive prognosis. What are the types of basal cell carcinoma? There are 4 main types of basal cell carcinoma, BCC, including 1. Nodular. This is the most common type of BCC. 1. Nodular BCC looks like a round pimple with visible blood vessels surrounding it, telangiectasias. 2. Superficial spreading. This type causes lesions that appear as small, shallow marks on your skin that are slightly lighter in color than the surrounding skin. 2. These lesions form on your trunk, torso, arms and legs. 3. Sclerosing, morphiform. These cancerous lesions look like scars that slowly expand over time. 3. This type is most common on your face. 3. This type can also take the form of a small red dot on your skin. 4. Pigmented. This is a rare type of BCC that causes hyperpigmentation, where an area of your skin becomes darker than the skin surrounding it. Symptoms of basal cell carcinoma. Signs of basal cell carcinoma include 1. Lumps, bumps, pimples, scabs or scaly lesions on your skin. 2. The lump may be slightly see-through, translucent, and close to your normal skin color or white to pink, brown to black or black to blue. 3. The lump may appear shinier than the skin around it with tiny visible blood vessels. 4. The lump may grow slowly over time. 5. The lump may be itchy or painful. 6. The lump may form an ulcer, which can ooze clear fluid or bleed with contact. What causes basal cell carcinoma? A change to your DNA causes basal cell carcinoma. This change usually happens after your skin has too much exposure to ultraviolet (UV) rays from sunlight or tanning beds. Your genes give your body's DNA instructions to make new cells to replace cells that reach the end of their lifespan by copying and replicating themselves. If a mutation affects one of your genes, your DNA won't have the instructions to make new cells as it should. Basal cells make new cells similar to how you turn on a light switch when you enter a room. When you need to enter a room, you turn on the light. When you leave that room, you turn the light switch off. Basal cells make new cells when their light switch is in the on position. If a genetic mutation targets your DNA, your basal cells aren't able to turn off the light switch when they leave a room. This causes your basal cells to make too many cells, which causes lumps, tumors, or lesions to form in the outer layer of your skin, epidermis. How is basal cell carcinoma treated? Your provider will treat basal cell carcinoma by removing cancer from your body. To remove cancer, your treatment options could include 1. Electrodesecation and curettage. Scraping off the cancerous lump with a curette and then burning with a special electric needle. 2. Surgery. Removing the cancerous lump or lesion with a scalpel, excision or Mohs surgery. 3. Cryotherapy or cryosurgery. Freezing the cancerous lump to remove it. 4. Chemotherapy. Using powerful medicines to kill cancerous cells in your body. 5. Photodynamic therapy, PDT. Applying blue light and a light-sensitive agent to your skin. 6. Laser therapy. Using lasers, high-energy beams, to remove cancer instead of using a scalpel. Basal cell carcinoma versus squamous cell carcinoma. 1 out of all types of skin cancer. Roughly 75% are basal cell carcinoma and 20% are squamous cell carcinoma. The remainder are melanoma and other rare skin cancers. 2. Basal cell carcinoma is the most common human cancer, with 3.6 million cases diagnosed each year. For squamous cell carcinoma, the total number of cases has also been steadily increasing for 3 decades. 3. The most common type of skin cancer, basal cell carcinoma, affects the basal layer of your epidermis, or the outer layer of your skin. This cancer is caused by a change in the DNA of your basal cells that makes them reproduce too many times. This is usually caused by an overexposure to ultraviolet (UV) rays from sunlight or tanning beds. A genetic condition known as basal cell Nevis syndrome can also increase your chance of acquiring this condition. While squamous cell carcinoma is the second most common form of skin cancer caused by a genetic mutation that leads to an overproduction of squamous cells near the top layer of your epidermis. Like basal cell carcinoma, this genetic mutation is caused by an overexposure to UV rays. Squamous cell carcinoma can appear anywhere on your body, but it's more commonly found on the parts of your body that are exposed to the sun, like your hands, arms, head and neck, and the parts of your face that protrude, like your nose, cheeks and ears. 4. Basal cell carcinoma tends to appear like a pink little bump surrounded by blood vessels, but it can also develop a lavender hue, while squamous cell carcinoma tends to be more pink and scaly. How cancer cells are formed. When genes work properly, they tell cells when it is the right time to grow and divide. When cells divide, they make exact copies of themselves. One cell divides into 2 identical cells, then 2 cells divide into 4, and so on. In adults, cells normally grow and divide to make more cells only when the body needs them, such as to replace aging or damaged cells. Diagram of cell division. But cancer cells are different. Cancer cells have gene mutations that turn the cell from a normal cell into a cancer cell. These gene mutations may be inherited, develop over time as we get older and genes wear out, or develop if we are around something that damages our genes, like cigarette smoke, alcohol, or ultraviolet (UV) radiation from the sun. A cancer cell doesn't act like a normal cell. It starts to grow and divide out of control instead of dying when it should. They also don't mature as much as normal cells, so they stay immature. Although there are many different types of cancer, they all start because of cells that are growing abnormally and out of control. Cancer can start in any cell in the body. If you are new at our channel, please subscribe our channel. It will be great support for us.